Hello, Rhode Island. In his State of the Union address, President Trump made something very clear. Federal healthcare dollars should go to the people, not the system. He's right. For decades, Washington has sent subsidies to insurers, hospital systems, and bureaucratic layers that most families will never see. Meanwhile, Rhode Islanders face rising premiums, growing deductibles, and fewer choices. Nearly 80% of voters say the healthcare system is in crisis or facing major problems. Almost the same number say simply spending more taxpayer dollars on the status quo won't fix it. The frustration isn't partisan, it's personal. That's why I became a founding member of the Great American Health Alliance, to advance a reform that does exactly what the president described. Redirect healthcare dollars from centralized systems to individuals. National polling shows 73% of voters support depositing federal healthcare dollars directly into personal accounts. This isn't about dismantling coverage. It's about restructuring incentives. Instead of routing subsidies through insurers first, healthier spending accounts would deposit funds into accounts that families own and control. Portable, tax-free, roll over year to year, usable for medical care and prevention. Right now, most Americans feel like they're renting their health care. Paying premiums feels like renting coverage with no long-term value. Ownership changes behavior. Ownership drives competition. Ownership lowers cost. And affordability is the issue of this election cycle. The president is right to focus on redirecting subsidies to consumers, but Congress must actually codify it. That requires representatives willing to move the idea from speech to statute. Healthier spending accounts would deposit health dollars into personal accounts that stay with you. Funds roll over, they grow. They can be used for medical care and prevention. They follow you, not your employer, not the hospital network. No matter how you're covered today, Medicare, Medicaid, union plans, small business coverage, you should have access to an account you control. Rhode Island should not be defending a system built around institutional power. We are a small state. We should be innovative, competitive, nimble. Instead, we are overly dependent on hospital monopolies and insurance gatekeepers. Healthcare should work for families in Warwick and Woonsocket, not just corporate boardrooms. If the money is going to go to the people, then let's make sure it actually does. In America's 250th year, ownership should not stop at property and business. It should extend to healthcare. Because when families control their healthcare dollars, they control their future. I'm Vic Miller, and I approve this message.